Okay, welcome. We're going to take a look at a couple of videos. Watch this one. We'll do it again in full speed. As some of you know, I've been requesting some videos from owners that come to our animal hospital of kitty cats that are 10 and over. These are some of those clips, and first and foremost we're just going to look at them, and then we're going to talk a little bit about osteoarthritis in cats. And I have news for you. Most of us as cat owners and as veterinarians are being fooled by our kitties. They are excellent at hiding discomfort and pain and osteoarthritis. So, spoiler alert, there are a lot of cats with osteoarthritis, which is basically the generic term arthritis. Osteoarthritis means it's not rheumatoid or some of the others, but it's the basic arthritis that we all think about. So, as you can see here, when you look for what you're looking for, you can tell that there's an owl here. But it's relatively hidden in plain sight. Imagine if you're in the woods and you were to see this tree. If you don't know exactly what you're looking for, you could easily miss it. And we see the same thing with kitty cats with arthritis. And I had been telling folks to send me videos of their cats doing a few different things, and we'll go over that again as we progress through here. And I'll show you some things as we go along. But one question you should ask yourself is, could my cat be affected? Is there a way that I should know? Why are we not seeing this and picking up on it? And I'll go through the challenges that we have as owners, because cats are really good at hiding things. And number two, your veterinarian it's very difficult for us to find arthritis in cats for a few reasons that we'll go through as we go along. So introduction phase, as you go through, you'll see something. We'll come back to these videos and you'll see something here that is important but could be easily overlooked until you see what I show you that you should be looking for. Here we go. This is a different clip with Elliot. He's also one of the kitties that was jumping off of that surface up there.
Come on, Elliot.
And the really good thing about this clip is that Elliot has other kitties with him. So let's look at it one more time.
Baby. Come on, Elliot.
Here we go. Once more.
Why are you so...
And the first thing I want you to pay attention to is the younger kitty here. Elliot, I think, is 10. And you'll see Elliot coming down in a second. But for a cat to be a catified cat, they come out as prey creatures. Look at this cat's focus. This kitty has a target, and he's not thinking about how he's getting to the target. He counts on his body to get him there without any question. And now, as you can see, Elliot is having hesitations and pauses as he comes down those stairs. So, in many cases, that is not considered much of an issue. Imagine if you're not taking this video because I requested it, and you're feeding multiple cats. It would be no surprise for you that Elliot, at 10, gets to the food bowls a little bit behind the younger kitties. And you may absolutely miss this hesitation that he has. Step, bring the other foot to. So that's one of the things that you can look for that would give you some clue that there may be something going on that's not quite 100% with your kitty. Okay, so let's talk about osteoarthritis in cats. First, how prevalent is it? Turns out, if you're a cat and you're 6 years or older, 61%. If they're radiographed to have x-rays, will have osteoarthritis. Once you get to 12 years old, %. When you go to the veterinary office, how often are they diagnosed? About 17%. That is pretty poor. Why? First off, cats are not small dogs. Dogs come in often on a leash. So there is a chance that your veterinarian will see them walking in. How do cats come into the hospital? First of all, they don't want to be there. And they come in this thing, the cat jail carrier. We do not get to see kitty cats in their normal environment. And cats will basically become a turtle. They take their feet and they curl them up under them. Second challenge. So one, they're hard to examine. They're hard to watch in motion. Your veterinarian is not going to see your cat like you see your cat. The second challenge is your appointment time is typically 20 to 30 minutes. And we have to talk about everything from, is the kitty drinking water? How are we eating? Are we gaining weight? Do we think we're losing weight? And oftentimes, as was the case with Elliot, if we say, how is he doing? The report from Elliot and his coming down those steps would be, he looks a little older. And that is where that conversation would stop without the video that we looked at. Then finally, if we talk about osteoarthritis in cats, previous solutions were difficult. Here's your kitty cat. You think you're gonna give me a pill? I think I'm gonna spit it right back out. Not very effective. Or in the case of non-steroidals, which we use in humans, And in our friends, the puppy dogs, they do not work well in cats. They don't agree with them. They can be harmful. So many times your veterinarian may not want to talk about these conditions, even subconsciously, if there's not a great option for how to treat them, for how to get them better. There is something new. Solensia is a treatment called a monoclonal antibody. You will see this on the end of almost most of the prescriptions that you will see advertised for humans. Just look at the end of the word in all of the treatments for rheumatoid arthritis, psoriatic arthritis, inflammatory bowel problems. Most of them will end with this. Solensia is a new treatment in this method, and we're going to see a little bit more of video and some use of this that we've done in the last few months. Really started using it more. I personally had a kitty cat many years ago that had very severe arthritis because of the way that he came to me. That is a story that I may give you guys another day. But internally, I kind of call this my Kaelo project, and as a nod to my kitty Kaelo. Kaelo was a very cool kitty cat. He was he had to amputate his right rear leg due to the way that he came in, and I ended up adopting him. And his left rear leg was also broken, so you could imagine that the number one joint in all cats, and especially for him, for arthritis, is not like dogs. Again, cats are not like dogs. So joint number one is the elbow. Joint number two is the hips. So we're going to look at some further videos, but what you can do is you now have in your pocket this phone, and you can get me 5 to 10 seconds of video of your cat in his normal environment, going downstairs, going upstairs, jumping down and jumping up, also chasing something like a laser pointer. Honestly, I've got very few of, I don't think I got anyone that had the cat playing. However, any or all of those will be helpful, and if you're not a member with Popular Animal Hospital, if you're not one of our patients, I would still tell you try to get those, especially if your cat is 6+, and bring them to your visit with your veterinarian and talk about Solensia. Solensia is one injection. It lasts 1 month. And it definitely seems to make a difference. I would absolutely try it for my kitty if it had been an option when he were around. We tried things from, most things were off-label for Kaelo. We tried something called Adequan, which is a dog and horse approved product. It's relatively safe. Didn't see a whole lot with that. We tried gabapentin, which I think just made him very loopy. We did do an NSAID, but we got a little bit afraid of that. There are new ones now that are maybe a little better, but they're going to be off-label. And the only thing that really helped him, believe it or not, was acupuncture. I did not have a laser at that time. That's another thing I would have tried, but definitely Solensia, the once-a-month injection is impressive. And I'll show you a video. Actually, we did give an injection to one of the kitties here, to Elliot, and I'll show you what he looks like after a couple of weeks. So take video, 5 to 10 seconds, get it to me, and you can be your kitty's superhero. Okay, I told you we were going to come back to this. So remember the elbow now being the #1 joint of arthritis in cats. As Honey, who is 14, is coming down, you can see there's major effort in trying to get these forelimbs as far down as we're coming off of this surface before we come off. That's to reduce the compression on the elbows. It's kind of called a drop down slide off. So if there is a surface below that the cat can get their legs to kind of slide down, we're going to reach and slide as far down as we can to try to make that compression on the elbows less. So that is something that you can definitely look for in your kitties. Now, the other thing that I mentioned was we're going to look at Elliot after coming down some stairs after his injection of Solensia. I think this is about 2 to 3 weeks. And I want to show you that in comparison with this one. Now he's kind of moving here, so I'm going to slow this down a little bit. Let's run this one again. You can definitely see a difference with him coming down as he doesn't have the hesitation. He's looking for his goal to scoot underneath. And it's right, left, no stopping, pretty smooth. Seems a lot more comfortable. Next steps. If you would record, like I was saying, 5 to 10 seconds, very short video of going up the stairs, down the stairs, jumping up, jumping down, and chasing. That's 5. If you get any of those, I would appreciate any or all of them. What you would do is you would send that to our email at poplar8h@windstream.net. Attention, Dr. Dr. Munn, and you can either put Solensia or Kaelo project. Now, for a limited time, and I do not know how many of these I will have, but we are going to create a little intro, I don't know what we'll call them, coupon, discount code, whatever you want to call it, for $20. Reduction in cost to do the first injection of Solensia. And like I said, it lasts a month. There are questions that you will have that will be unanswered in this introduction, like what are the expectations, what time period. Those I will be glad to go over with you individually, and we can cover any of those questions, any potential issues, side effects, things that you may be on that would interfere. There aren't really any, but if you would like to take advantage of this, get me a couple of these videos. Do not have to do all 5, but whatever you can get, I would be happy to get those and to try to see what I can glean from more information that we get, the better. So in conclusion, I will leave you with some images of Kaelo, the kitty that I adopted. He was actually, this was not 1998. I met him in 1998. He was dropped off to be euthanized due to being hit by a car at about 3.5, 4 months of age. And as I went to get him out of the cage, he hopped into a litter box and had a normal stool and was able to keep himself away from me with 2 completely destroyed back legs. One looked like it had been in a blender. That was his right rear leg. His left rear leg was broken. I had to talk a doctor, because remember, I graduated in 97, so I was out a year. I couldn't do either of these surgeries on my own, so I talked a doctor that worked with me at the time, who I still know today, Dr. Plott, and he helped me remove the right rear leg. So we amputated one leg, we pinned the other, and he basically got around on that, on his front legs, pulling him around the rest of his life. I had told the folks that allowed me to give him a chance that I would do my best to keep him from being painful. And originally I thought that was going to mean, if he didn't do well through surgery, not making him suffer. Little did I know that he would live 14 years and teach me lots of things about arthritis and discomfort and trying a number of things, skeptical about acupuncture. He actually showed me that it works, and he was quite an interesting cat. He taught me a lot of things in the time that he was with us. And 2012, eventually he was just too uncomfortable and his kidneys were losing function. So my daughter is the artist in our family. We can't even play Pictionary because it's not fair. Whoever has her always wins. And she drew this when he went on beyond. You'll notice that in her depiction, his right rear leg is back, which she informed me that's the way that works when he gets his wings. So I don't know, maybe I'll call the first discount on this Kaelo bucks or something, because just a little tribute to him and all he taught me, and trying to help the kitties that we can with arthritis, that I got to know him that dealt with it as best he could for a good long time. So thank you for your time.